First of all, Laniado Hospital is a community hospital, which means he gives all the medical needs of the Netanya population, which is about 300,000 people all around. And that is our main task. The origin of this hospital is a rabbi. He had a wife and 11 children. All of them were murdered during the Second World War in the concentration camps. He managed to survive, and he vowed that if he will manage to come back to Israel, he will establish an hospital and he will give assistance, medical assistance, to everyone who needs it, regardless to his age, to his color, to his nationality, or to his religion. And that's what we are doing.
My name is Dr. Benta, and I'm in charge of the intensive care unit, neonatal intensive care unit in the Laniado Hospital. We treat here small babies, bigger babies, those that are born preterm, as early as 24 weeks, which is about 6 months of gestation, which is quite early. Actually, at the moment, we have here 2 babies like this that weigh less than 1 kilo. And otherwise, big babies that have any problems, medical problems that need to be addressed. And we have something like 350 admissions per year here.
This is the best place to give life, to see them grow, to hold them, to hug them, and when they're going home, they're coming to visit us, and when they're 1 year, they're coming to give us a cake, and we all celebrate together with them. So this is the best place, I think, for nurse to work.
Such a unit in the intensive care costs about $50,000. Okay, so if we don't have this equipment, and which is the up-to-date, the most up-to-date equipment, then this has implications on the treatment, and implications on treatment have implications on the future of these children, babies, when they grow up to be children and adults. So this is a direct connection between quality of people, quality of treatment, and quality of the equipment. We're trying to do the best for these babies, Bezrat Hashem.
You give her the best equipment, so we can give the child the best treatment, and they can grow and go home. So when you're giving us the money, you support us to give the child life.
First of all, I'm happy, very happy with my duty as to be a pediatrician, to be a mater-oncologist, and to save life of children. As you know, if we deal with cancer, now we cure about 80% of children, and when you cure them, it's not that you finish and that's it, because the follow-up is going till very, very long. They have bar mitzvah, and they invite me, they married, and they invite me, they have children, and they invite me. So we are really, really very involved in their life, and for me it's like naches. Myself, I feel that I protect them, and I protect them in the future, of course. It's very important, your support in Laniado Hospital.
Our mission is to regenerate blood supply to tissues that are damaged by small to medium blood vessels malfunction, and this is why they don't get blood supply to these organs and tissues, and we want to regenerate that, and by doing that, saving their limbs or hearts or other tissues and organs in their body. We know how patients feel when they cannot walk or suffer from pain or losing their legs. We want to sleep at night knowing that we did the best we can for them. People who are contributing to Laniado are becoming part of a huge effort that is done in all areas in Laniado to save lives and to protect lives and quality of life. We need for much more in order to help many more people.
We love the people here. We look at every problem that annoys them. We look at everything that can make them better, that feel better. If, for example, a person is suffering from dementia and in the late stages he suffers from behavioral problems and he is sometimes agitated. So we look for the things that can make him feel good, calm. He can listen to the music. He can sit and see the fishes we have in aquarium. And we have a special room that he has lots of stimulations that he can have. And we are not thinking about the medicine. We are thinking about other ways to make him feel comfortable.
It's the home of old Jewish people who have nowhere else to go, and we treat them with respect and help them to pass the last years of their lives with self-dignity and in the heart of the Jewish tradition. All the professionals here treat the patients as if they're our parents, our grandparents. I get a lot of satisfaction by helping the patients.
My mother is sick for many years and we are here so many times, and they were wonderful, really great people are working here.
Part of the reason this hospital is so special is because the people here they take the patient as a person and they really speak to him in a personal level. They know all the patients by name and they know the family members. When someone who's in ICU feels better and well enough to walk out of here, everyone just walk out in a parade. I hope that in the future we'll have one just like that very soon.
There is no limitation of age. If there is a patient who needs to be on a respirator, we don't prevent him from the machine because of his age, because the age is not a factor in treating the patient. My mother was here at the age of 98, and they started to ventilate her, and after a few days we disconnect the ventilator because she breathed by herself. And she lived another few months. We do everything to support and to maintain life. We give all the medical attention and medical management that the patient needs on Shabbat, on Yom Kippur, every day, 24 hours a day, 365 days a year.
In 2011, we've had 5 major events which have involved a tremendous amount of young people. And our main goal is to protect them, is to care for them.
When I was a kid and we're talking about soldiers being injured or people getting hurt from bombs and whatever, it was only in the border. Because now trauma is everywhere. We had terror attacks in Netanya, too many. Okay, and now every hospital in Israel is a trauma center. And we are supposed to know and to deal with the victims of trauma, with soldiers and civilians who get hurt by bomb attacks or whatever. Civilians became soldiers, okay? The terror is everywhere. We had to change because we have to deal with major trauma victims. and it's changing the whole hospital. Laniado is not a big hospital, and it doesn't have a lot of resources. And in order to treat a patient who had a major trauma, we need a lot of equipment and a lot of we need a team work in order to do it. We need ICU is the most important thing for trauma victims, and we need more equipment in the operating room and more operating rooms.
And thank God that you guys outside in London are there to support us, to think of us. And, you know, you are the soldiers in reserves from Chutz La'aretz who are helping us in spirit. And it is a bond that, that is a lifeline for all of us.